Hey everyone, welcome back to another video. In this one, we want to talk about breast implants. Yeah!
Breast implant illness specifically.
Yeah.
And the wackadoos
That plague the internet.
yeah. They first start by trying to school you, and then they digress into, I hope you get breast implant illness.
Yeah.
Always.
So the background to this video is basically like, well, first of all, Brianna has breast implants.
Duh.
And we've been tagged in a bunch of posts. We're in a bunch of health groups, her especially. And there's like literally groups with hundreds of thousands of people in them that are dedicated to promoting that breast implants like cause every disease ever invented.
Yeah, the group is ran by a girl named Heather, and she actually gets kickbacks from the surgeon.
That removes breast implants.
It's
funny.
The whole thing is shady, and they think that they're like being altruistic, and they're not.
But to be blunt, the reason we want to do this video is to really set the record straight on what the data shows about breast implants, because a lot of women are getting scared into having their breast implants removed, and it's ruining their bodies.
And it completely ruins their body.
Yeah.
Like, destroys the muscle tissue. Like, what they're doing is asinine, and it's very... I don't know. I feel very, very sad for these women that destroy their bodies because of this false information.
Yeah, because they truly believe that their health conditions that they very well may be experiencing are caused by the implants.
And it's probably not associated at all.
Yeah. So...
Probably not being key.
Yes, probably not being key. So, in a discussion like this, where do you start? So, just like a couple things I just want to spit out right off the top is, first of all, silicone. Most breast implants today are made from silicone, okay? And silicone has literally been used in prosthetic devices since the 1960s.
Well, it's used in so many things, too.
Yeah, and why is that? Because it's benign and it's biocompatible with our biology.
Like, a lot of people don't even realize that, like, contact lenses and other
stents that go in the heart, spinal implants, like every
You're probably getting more in your food production too.
Yeah. Yeah.
Everything's cooked in silicone.
The point of mentioning that is that silicone is overwhelmingly safe to be inside the body, including in breast implants. So
that's why we put it in former cancer patients.
Right.
For reconstruction.
So anything that has to do with breast implant illnesses can't actually be related to the breast implant itself. Notwithstanding, a ridiculously small group of people that might actually have some type of allergic reaction or something to silicone.
And it's an actual allergic reaction. It's a breast implant illness that's going on.
So that's the first thing to get out of the way. The second thing is that acknowledging that there has to be something else about breast implants that could possibly give rise to things people experience. What could those be? Well, there's two options. The first, frankly, is that people just make shit up in their head. It's psychosomatic.
Health anxiety is very real, and if you have it, then you need to seek some kind of resolution for that.
It's called a nocebo effect, opposite of the placebo. Placebo effect is for health benefits. Nocebo effect is for health detriments. And basically, people join in these groups. They read on social media everywhere.
All day, every day.
They start truly believing that they might have these conditions. They say, oh my God, I have brain fog. It could be my breast implants. They never had brain fog. They think they do, and now suddenly they have it every day.
Or they could have it. The autoimmune conditions are very high in women compared to men, and the onset is usually in the 30s. And so it could have nothing to do with your breast implants. You could have something else.
How long do people usually have breast implants? Years. We know age is the number one risk factor for like everything.
Every health condition.
Right.
Mitochondrial degeneration, right? Happens as we age.
So maybe you just got sick because you're getting older regardless of the fact that you've had breast implants, right?
Yeah, there's so many causes that could be causing your symptoms.
Yep. So what's the other thing? The second thing is a bacterial infection. And this is actually the leading hypothesis for
bacterial biofilms.
Yes.
And that's what I looked into when I was picking my surgeon, is someone with a very low capsular contracture rate, because that means that there's been little to no bacterial biofilms that have contaminated the capsule.
Yeah, because that's the number one complication from a bacterial infection. But just think about how you feel when you have an infection in general. Low-grade systemic inflammation, that could easily give rise to all of these different problems that people attribute to the breast implants. It's not actually the implant, it's that,
Capsular contracture is very rare, though.
Yeah,
These biofilms are very rare.
My joke being, though, is they got their money's worth and got an infection because of it.
They got their boobs in Tijuana where they didn't clean things.
Yeah.
And now they really do have breast implant illness.
Yeah, for real. But it's not because of the breast implants, because of an infection that happened either as a result of crappy procedures, or because it does happen with even the best surgeons. It could be something related to just like their own microbiome, maybe some bacteria off their skin.
Yeah, they do think that repeat cases that like have explant and then reimplantation and they keep getting capsular contracture, it's very rare, but it does happen. They think it's a skin microbiome thing, and even if they clean very well, like it still happens to these snowflakes.
So this leads us right into the number one condition actually associated with breast implants, to the extent that there's a black box warning on breast implants by the FDA. And that is, I can't remember the name, but it's ACLC. It's a type of lymphoma, which is a cancer of the immune system. And the reason it's relevant is because 85% of the cases reported to the FDA were owed to a specific type of textured breast implant produced by a company, to the extent that the FDA told that company they needed to elicit a voluntary recall.
Textured implants harbor more bacteria, and
yeah,
that's the reason.
So textured versus smooth.
My surgeon was on the FDA board, and this was I think 7 years ago that I got 6 years that I got my first.
I don't know.
Anyway, he told me then, before they were recalled, that they harbor more bacteria, and he would not even put them in anyone.
Yeah. Think about it. A lot more nooks and crannies when you have
And he had a very
bumps,
low capsular
right?
contracture rate.
So that's, people use them because of all those nooks and crannies, the tissue can bind to them better. It can hold the implant in place.
So they were marketed as like they feel more natural. Like I remember when I was looking, that's how they were marketed. And women, they think they want the natural feeling ones.
Yeah, they feel more natural. They stay in place better because the tissue's better able to grab onto it.
Mine have never moved.
But
so.
Yeah, really, if you're gonna get them, go with smooth, because the differences are negligible if they exist. And
yeah, I don't even think they recommend the textured anymore at all.
And that's the reason why, is it's just easier for the bacteria to survive any sanitation procedures and make their way into your boob along with the implant. So
talk about the amount of people that actually got.
Oh yeah, and here's the other thing too. With all the fear mongering around these illnesses, there's only been 3 things that the FDA has actually sent out an advisory about, saying you should probably tell people that they might be at risk for this. Okay, only 3 things. And before I mention those 3 things, I want to say that there have been hundreds of thousands of women getting implants every year in the U.S. for decades. In 2017, they finally surpassed 300,000, and it's been growing ever since. But still, as many as 200,000 as far back as the year 2000 were getting breast implants every year. So millions of people around the world, or in the U.S. alone, have breast implants. Millions. Possibly tens of millions.
Yeah, you can't
and
tell.
At a global scale, I mean, just ridiculously more. There were 700 and something cases of ACLC, okay? Out of those millions of cases, to the extent that studies have found that the risk of developing ACLC is anywhere from 0.35 to 1 case for every million women that got implants. Ridiculously low rate.
Doesn't warrant the fear mongering, that's for sure.
And that's looking at overall rate. That's not even considering the type of implant. It would be astronomically lower if we're looking at smooth implants only. And obviously much higher if we were looking at texture. The other two things that actually just came out this year was less than 30 cases of squamous cell carcinoma and less than 20 cases of other lymphomas that aren't ACLC. Okay, so, and again, that's for over millions of people. Like, and none of these have been causally tied to breast implants.
No, they're just places to investigate.
They're case reports that have been reported to the FDA, which it serve no purpose other than being a signal for further investigation. But the data we have that has actually extensively looked into the links between breast implants and a variety of illnesses has found no link between breast implants and cancer in general, including breast cancer, connective tissue diseases,
or melanoma. A lot of people like to say
yeah,
that about
or
me.
melanoma, mental health, neurological, and even reproductive effects and effects on the babies of women that have implants. No links in any of these looking at the research that we have available. We only have case reports given to the FDA, and the risks of these happening based on those case reports, astronomically low.
Yeah, I think the last thing I want to hit on is the belief that your doctor's gaslighting you if he doesn't confirm that you have breast implant illness. He's not, they're not gaslighting you. They want to find the cause of your issues, and it's not likely to be related to your breast implants no matter how much you think it is.
Yeah. I mean, yeah.
They want to fix you. They want to help you. People aren't malicious. There is some dickheads out there.
Always.
There is. I came across them myself when I've had diagnosis, but I don't think most of them are doing that. I think they're just like, well, it's not probable, so let's test you for this other stuff.
Yeah. It's like just because you think something's caused by your breast implants doesn't mean it is.
They're not gaslighting you.
Yeah, they aren't denying that your reality exists. Obviously, they're acknowledging that you have a illness or a symptom or whatever, but all they're doing is saying that based on what data we have, it's unlikely to be breast implant related. So, yeah. Hopefully that clears the air, and we're gonna have a write-up done associated with
this.
this.
Yeah, and I'll answer questions. I'm in a lot of groups, and I'd be more than happy to link an explant regret group that I think is very, very helpful with women that have pulled them out, noticed no benefits in their health and only detriments to their psychological well-being. So there's that side of the coin. Like, if you want to get on the breast implant illness train, you need to look at the other side as well.
Yeah, exactly. So yeah, I guess the quick note summary is that most breast implants are silicone. Silicone is incredibly biocompatible with our bodies. It's unlikely to do anything detrimental except for possibly people that have an allergy to it, which is very, very, very few people.
And you'll know.
Yeah, and you'll know. If there is something related to any prosthetic device, not just breast implants, it's likely related to a bacterial infection, in which case you're going to need to have follow-up surgeries to get that infection cleared out.
And work with a plastic surgeon.
But even those are very rare, and you can minimize that happening by, first of all, going with a great plastic surgeon.
Yeah.
And getting
doing your due diligence.
Yeah, exactly. Doing
not
your due
paying
diligence.
I wouldn't cost shop for plastic surgery.
Yeah.
That's just something you just don't get it done.
Yeah.
Don't get it done if you can't afford it. Don't. Oh goodness.
Oh,
yeah,
goodness.
we need to wrap this
Yeah,
up.
he's done. So, and going with smooth implants can minimize that. A lot of health effects could just be psychosomatic as well, as opposed to a
people hate
bacterial
hearing that.
infection, because you've been spending too much time in these groups and
Health
you've just
anxiety.
developed health anxiety, right?
And you want to take control by taking your breast implants out because it'll make you feel like you're doing something.
Yeah.
And doing something is how you gain control or the perception of control over anxiety.
Exactly. Okay, so
We're gonna wrap it
thank
up.
you. Yeah, so thank you for listening. If you like the video, please do like it and share it around with all of your friends and in groups. And of course, ask us any and all questions that you have. And if you haven't already, please subscribe to our YouTube channel. Thanks, everyone.
Bye.